Jerry. So that was one way, and eventually that became to known as the Italian way of nasal reconstruction. But before Tagliacozzi, there was a family by name of Branca family who secretly passed down the technique from generation to generation, not let anybody ever see it, because this was like, you know, they patented it, so to speak, for their own family.
Right, their own proprietary nose procedure.
Exactly. Now, the Indian method of nasal reconstruction used tissue from the forehead. Now, the idea was again that you wanted to use tissue of about the same thickness as the nose. And so they took a leaf, like a leaf of a tree, and used the drawing on the forehead in the shape of the leaf of the tree, maintain the blood supply to this little root in between the two eyebrows, because there's a very strong blood vessel that runs up there. It's called the trochlear artery. And then based on that, they can lift it away from the forehead and turn it down to make it into a nose. Now, I have this question, what happens to the defect in the forehead? They would pull that together with sutures. That would be under little tension. That would, eventually the scar would spread, but you could redo it again. But still better, you could revise the scar than not having a nose.
But the aesthetic part of plastic surgery is relatively new. These were reconstructive procedures.
Well, they are, but yes, they are. But there isn't as strong a definition and a division between aesthetic and reconstructive. Most of us end up to be good aesthetic surgeons who were trained very majorly in reconstructive surgery first. And this is what happened with the aesthetic procedures too. And I'm glad you asked the question you did. But the aesthetic procedures grew out from reconstructive procedures.
Right, it was an evolution.
It was an evolution. And I was going to come kind of to that in a minute, but I'm glad that you accelerated my way of explaining this. The first facelifts, for example, were performed because there were defects near the hairline that were closed by pulling up the skin, and people said, geez, that side of the face looks younger. You know, and that's how the initial facelifts came about. Now, of course, breast augmentations, and every procedure for breast augmentation, you need to have an implant, even though before implants, paraffin and silicone and everything else was injected.
I was fascinated to see there was a German doctor who tried to transplant a lipoma, which is a fatty tumor, from the back of a woman and make it into a breast.
And he was quite successful, and that's a historic case. He was Dutch, actually.
Dutch.
And it was quite a significant procedure, also because most of that lipoma, which ordinarily would not, survived somehow. And that all has to do with revascularization of you cannot just take a piece of tissue from here and put it to there unless you use microvascular techniques where you make new vascular connections. But this particular lipoma has done quite well as a enhancement of one of the breasts. And yes, that was done by a Dutch plastic surgeon in, I think, in the early, maybe 1930s or so.